Okay, so my background from an education and professional training point of view to bring me to what I'm doing now is I did my first university degree was in physical and health education, which basically gave me the base for the world of sports and human movement, but I realized I didn't want to teach PE, and I didn't want to do coaching and things like that. So I was interested in the world of injuries and rehabilitation. So that's why I went further my studies and did a physiotherapy degree, and I did that in London at King's College London. And at first, when you do a physiotherapy degree, you have to, once you qualify, you have to do rotations in all the different areas inside the national health system, which is the health system in the UK. So I did rotations in every area that physiotherapists work in. So that includes neurology, pediatrics, respiratory, intensive care, oncology, so lots of different parts of clinical work where physios are involved. And I realized after a couple of years of doing those rotations that I actually enjoyed being in outpatients musculoskeletal. So I was working with a lot of people doing back pain, knee pain, neck pain, and I then worked alongside this women's health physio who was a very inspiring person in my life. She's one of my best friends, and I wanted to see what it actually meant to work in women's health. So I went into that rotation and I never looked back, because it was extremely rewarding to help women understand about their bodies and how by having a simple amount of education sometimes could affect how they changed symptoms and had a much better quality of life once they took that on board. So I did, when you do a women's health rotation in the NHS, you get hands-on experience from your clinical supervisor. So that's where I first did my patients' vaginal examinations, but I then, from then on, went on a number of specific postgraduate courses to prepare me for working in this field. Normally, you don't get taught this at undergraduate level in physiotherapy, so it is usually a postgraduate specialization that you do. Some degrees nowadays are teaching physiotherapists to understand the world of pelvic health, but it's usually after you've worked for a few years that you then get exposed and you get postgraduate specific training in dealing with pelvic examinations and pelvic health treatment.